only is it a misconception to say that a patient is cancer-free, I'm going to use air quotes on that. It is the biggest misconception in the world of cancer to say a patient is cancer-free. The fact is, there is no clinical diagnostic test, blood test, image, scan, or otherwise, that can detect cancer at a nano level. So no one test can determine if there's a cancer cell in my liver that's capable of creating a metastatic tumor down there. No test can determine if there's cancer free in my blood. No test can determine if there's cancer in my bones that is inactive at this time, but will someday later create a metastatic tumor. In fact, a scan can only detect cancer that is the size of 3 millimeters, so about this big, about the tip of my pinky nail, right? A scan can only detect cancer once it's that big. Now, that can be a whole hell of a lot of cancer when it comes to 3 millimeters. So the tip of a pinhead, for example, can hold 1 million cancer cells. So to become 3 millimeters big, you're talking about 4 to 5 million cancer cells. And that's a lot of cancer cells and a lot of capacity to spread beyond that. So patients love to use cancer-free, and oncologists love to use the term cancer-free as well. But the fact is, you just don't know. And it's a really crappy thing to say, but the fact is, once you've had an invasive cancer, the only way that you know that you're actually cured is when you die from something else. So we're trying to kind of rid the vernacular of cancer-free and focus on cancer as a chronic illness. Cancer as a chronic illness is something that you could live with for a long time. And for example, if you can make stage 4 breast cancer a chronic illness, something you can live with for a long period of time, decades even, you kind of take away that fear that early stagers feel, right? So what's the greatest concern of an early stage patient? It's one word, it's recurrence, it's metastasis, it's stage 4. So if you could treat cancer like a chronic illness and manage it over the long haul, you can really save the most people and also alleviate a lot of the, of the internal fear that most of those early stagers fear.